Massachusetts launching this $1 million taxpayer-funded campaign.
Whether you need pregnancy care or abortion care, avoid anti-abortion centers. They may look like medical clinics, but can put your health at risk.
And when announcing the attack ad, the lieutenant governor said the troubling practices of anti-abortion centers serve to undermine the trust that people should have in our healthcare system. Education can help counter the misinformation and unethical tactics these centers use. Joining us now, the executive director of the Boston Center for Pregnancy Choices, Diane O'Toole. So, Diane, they're saying that pregnancy centers are dangerous. Why are they saying that? What is so dangerous about an ultrasound and baby clothes and diapers?
There's nothing dangerous about our centers at all. Actually, our clients give us a 98% satisfaction rate on our exit surveys. Our clients love us, so it's just incredibly amazing how we're being attacked right now by our government.
Right, using your own tax dollars. It's incredible. Whatever happened to choice? Because this is a choice. You know, in the state of Massachusetts, they have abortion clinics, but then there are pregnancy centers for those who, by the way, 80% of women who've had abortions say they wouldn't have done it had they had help and support. And that's what these centers offer. So why are they so afraid of women walking into these centers?
Actually, because it affects the abortion clinic's bottom line. We help women and men to keep their babies, and the more babies that are born rather than aborted affects the abortion industry's bottom line, because the more abortions they perform, the more money they make.
How worried are you that this ad, I mean, it's got $1 million behind it. That's a lot of money. How worried are you that it will affect people coming to your centers and really erode trust in pro-life pregnancy centers?
Yeah, it's actually very sad, because unfortunately it's a scare tactic to scare people away from the pregnancy resource centers where they can truly get help. I mean, I was one of those people. I got pregnant when I was in high school, and I wanted to keep the baby, and yet without support, honestly, I was pushed into an abortion. And I help those women, and my team and other pregnancy resource centers help women like me. And without us being there, there's really millions of dollars that wouldn't be spent on help for women to be able to keep their babies and the resources that we have available for them.
Yeah, that's really what most women want. They want help and support. And I've met so many people who work at those pregnancy health centers, and they're angels. They're angels, and they treat the women who walk through those doors as if they were their own daughters. And it's really sad to see this happen. Has there been a reaction from the people of Massachusetts? How do they feel about their tax dollars being spent this way?
Well, I know that there are many people that are very upset, especially because, you know, we are supported by individuals. We are completely funded by the individuals who care about the work that we do. And most of us are actually religious charities.
Right.
And so,
volunteers.
Yeah.
Yeah, you're volunteers. Well, I just read an article that the state of Massachusetts is the #1 most expensive state in America, and I bet the taxpayers would not like to see their money going $1 million towards discrediting a charity for women who want diapers and ultrasounds and baby clothes and a little bit of love and support in their most difficult times. And Diane, I really thank you for bringing this to our attention, and also for the work that so many people like you have done. And thank you for sharing your story. I think that means a lot to people. A lot of people have been misled into abortion clinics, and you speak for them. So thank you.
And thank you. I mean, we're women helping women, and I just want to get that point across. And the services that we provide, like I said, we have a 98% satisfaction rate. Our clients love us, and we're here just to care for and support them.
Yeah, I can see that. We reached out to the governor, by the way, to get his response, and he has no comment. So she has no comment. Thank you so much for joining us, Diane. Appreciate it.